calling to order Health and Family Services Committee.
23.
Attendance,
Mrs. Geiger,
here.
Ms. Vedder,
Here.
Mr. Ruiz, Mrs. Labuda,
Yes, here.
Mrs. Edwards. Yep, quorum.
Got agendas? Yeah. Okay, thank you all for coming and Happy New Year to everybody. Looking forward to 2014. And I just want to thank the staff for the work that we did in the last 2 years, because I think we have accomplished much. The savings that, the staff and Commissioner Parker brought forward to bring us within the tax cap is greatly appreciated by a lot of people. I also wanted to say that in 2014, I just was gonna change the agenda format a little bit. And as far as monthly reports go, I think it would, instead of kind of putting everybody on the spot at the end of the meeting and saying, do you have a report? If you wanna bring a written summary in, and it would be due when the agendas are due, the week before the committee meeting, just to be attached to this.
And then they'll be
so
a
that
part of
we
the
can-
minutes.
Right, so then we can review it. So I think that way, with some of the departments that maybe don't get as much input into the committee, I think maybe that'll help us. We can review what you're doing and what's happening, and then if you wanna add something to that, I think that will help us out a lot too. Okay, we're gonna move into our reports, and that's, our ACC administrator on the HEAL grant update and feasibility study.
Well, the good news is that 99.9% of the work is done with the HEAL grant. We have a few things that will need to be done post the Department of Health inspection, which is scheduled for tomorrow morning, weather permitting. So we do have the walkthrough set up. And from that, we will probably get a punch list of items that they will want completed prior to the actual okay to go ahead and, reopen it and move residents in. So it's actually amazing in terms of, it looks wonderful. A lot of work has gone into it, and you can really see the benefit of a very nice product completed. So we're really looking forward to having that available for our residents of the county and those that need the short-term rehabilitation services that this unit will be geared to, as well as subacute care. In terms of the feasibility study, what I have is that Rotenberg Healthcare Consulting is the organization that actually sent Management and Budget a request yesterday for a list of about 15 items that need to be gathered up, informational items that they're anticipating about 6 weeks from whence all the information is obtained to have the feasibility report done.
Okay, so what's the time frame in relation to today? How far?
Well, in terms of,
No, I mean, when would that report be done?
they said about 6 weeks from when they get the information, and I just got this
Okay.
a few minutes
So
ago.
about 2 months.
Yeah, about 2 months is what it should be.
Are you planning an open house for the new unit?
Yes, we are. I thought that after this meeting, I would stop in and see if Michelle could help us work on getting a date, and then the appropriate people through Josh's assistance, and in terms of who should be invited to to plan the event. We obviously want to make sure that it's very positive and upbeat, and that all those who should be there are there to help embark on this celebration.
That's exciting.
Very.
My other question was, as far as, opening it up to residents, how does the word get out there that you're ready to take people in?
Well, the first steps will be actually, once we have the date, the official date that it can be opened, the process is the, residents are notified, or we speak to the residents and the family, depending on the person's situation, or, official representative, to let them know and discuss that they may be moved to that particular unit. Family council is notified and worked with, so there's actual process of the internal notifications. Now, we did, have within the budget, and my understanding it has been approved, for a marketing outreach coordinator, which I have to get permission to fill that, position. And that's gonna be actually key in getting the word out to the community, as well as actually coordinating the admissions, because with a subacute rehab unit, the turnover for the residents is a much faster turnover, because they're here to come in with a particular situation, get their rehab or their treatment, get better, and go back into the community. So it's a short-term component of what traditionally has been a long-term care facility.
So was that position put in your budget? Okay.
Yes.
So, 'cause I mean, it's important, I mean, now that we have the unit, we need to advertise outside the county if we have to
Lewis,
get, to fill that unit, because that's gonna keep the facility alive, so, so your PR person actually hasn't, sent out anything yet, correct? You're gonna wait till it, okay.
We don't,
How-
yes, we're gonna fill the position, but simultaneously work on getting the word out. You can't wait till the position is filled, obviously, to.
So when are you gonna fill the position?
I believe it will be on an agenda.
It has to go to the executive committee
Thank you.
later in the month
So
for
then,
approval.
so is it part of your budget or not?
I
It's in your down,
understood,
14
So,
down.
so why does that go to executive?
Because
Because
it's a vacant
you're filling a
position.
vacant position.
I'm sorry, I'm not clear on what the position is. You're talking about short-term rehab.
yes.
So are you talking about a physical therapist? Are you talking about an occupational therapist? Are you talking about a manager of that department? Exactly what are you talking about? Because if I had the broken hip and I was going in for rehab, I'd like to know that in fact you have a physical therapist that is gonna be able to see me and take care of me X amount of days a week. What position are we talking about? Is it manager of that section, or is it a therapist?
Well, we were actually talking about a marketing outreach coordinator, which would actually be the person who, works with hospitals and other organizations that might be potential referral sources, to be able to get the referrals, quote unquote. Competition actually sends representative to hospitals, where they actually develop a rapport with the discharge planners. And then it's a coordinating, not a hands-on position. The unit has a unit leader, which is the clinical component, and then rehab has the supervising rehab individual. So you have within the different levels. The marketing outreach coordinator is not a clinical position. It's not a hands-on. It's somebody who's actually gonna help walk the person through to get them admitted, take them from, for example, the hospital or the home where they are, and actually help them get settled, get the paperwork done, get all the finance information, and establish that relationship so that those in the community that could make referrals really understand what we have.
So that would be the link to the hospitals like Catskill Regional and, right.
And Orange.
And like you said, other facilities that offer rehab have those people going in, building the relationship, so there is kind of a competition there.
Yes. And have had for a long time, so.
So that's why.
This will help us in terms of, right now, the referral process is so fast, and the need to have that relationship with discharge planners, because the reality is, they do control a certain amount of where people end up going, as well as physicians.
And from what I understand, the need is growing because of the shorter hospital stays. Am I correct, too? Mhm. Okay, are there any other questions? Debbie, thank you, Debbie. Community health assessment, health improvement plan, Nancy McGraw.
Hello.
Hello.
I have, can give you the short version or the long version.
Short.
Short.
Short's good.
We need to get more help.
This is a project that was mandated by New York State Health Department. It's a 4-year plan. There's 2 pieces to this. I'm only giving you the community health improvement plan because the community health assessment is about 200 pages, which I don't think you want, but it's available on our website.
Those trees.
I'll take one.
Yeah.
2 more.
State Health Department requires local health departments to update their community health assessment every 4 years. And this year, for the first time, instead of a municipal public health services plan, they have required a community health improvement plan, which really identifies what the major health concerns are, and to come up with a coordinated plan with the community to address some of these issues and to set some priorities. So we have, going back about a year, been working with Holler and Consulting, and we held several focus groups, distributed over 750 surveys. About half of those surveys were online and about half were paper-based, and reached out to all areas of the county and county residents. We coordinated our efforts with the local hospital and with community organizations that are involved with the Rural Health Network, which is basically our health department's community planning body that's been helping a lot with identifying what some of the major issues are and how to address them. So this is our plan, and I'm not going to go through it in great detail, but I will tell you that the major priorities are to prevent chronic disease, to promote healthy women, infants, and children, and to promote mental health and prevent substance abuse. And these are priority areas that follow New York State Health Department's prevention agenda for the whole state. We were asked to pick, if you go to page 9, there's a matrix there with a bunch of boxes, and we were asked to, as a community, to identify which of these 5 major categories we wanted to focus on over the next 4 years. So you can see that under prevent chronic diseases, there's several areas that have to do with improving our mortality rates due to heart disease, reducing cancer incidence, reducing obesity among youth and adults, addressing asthma, access to care, and as far as promoting healthy women, infants, and children, also we have access to care, improving prenatal care in the first trimester. Our rates are quite low. We have a lot of women that don't access prenatal care until their 2nd or 3rd trimester. Our teen pregnancy rate has improved, but it's still quite high compared to the rest of the state. We have a lot of low birth weight infants and premature infants, so we're going to be working specifically with various organizations that work with these populations and with the hospital to improve prenatal care and breastfeeding rates, which improves health, and to reduce premature birth. Promoting mental health and preventing substance abuse. Our county has a higher suicide rate than the state rate. There's a lot of drug abuse, and as you know, we've been trying to do a lot with our prescription drug abuse task force through the Rural Health Network over the last couple of years. Reducing smoking and improving mental health in general in collaboration with community services, the hospital, and various partner organizations. So those are the 3 major categories. It's a big agenda. The health department cannot do it alone. Obviously, we work very closely with these partners, and we have identified some focus areas and goals and objectives. And at the very end, you will see that Catskill Regional Hospital also has their report, their community services plan at the end, and it's aligned with the local health department's plan. And our major priority areas are the same, and we will be coordinating so that we don't duplicate our efforts, and we'll be trying to share resources. Are there any questions?
Yeah, just, the response was in county, or was it a regional survey? How did that work?
This was Sullivan County.
It was just Sullivan County alone, and what, did you get a good response?
We had over 750 surveys, which is a really good response. I think-
Returned, you had?
Yeah. Last time we did this, I think we had around less than 400. So this was really well done.
So without having a chance to review it, the priority areas in the matrix box, so then you move forward and pull out, like an action plan to address some of these?
Right.
And do you have like a time frame?
Well, this is a 4-year plan, but we're going to be getting off the ground soon with something I wanted to let everybody know about today as well. Last month, we requested permission to apply for a grant through the University of Wisconsin County Health Rankings and Roadmaps. So we were notified just last week that we were awarded that grant.
Good.
And we're going to partner with, we're gonna focus on nutrition and childhood obesity first. We're gonna partner with the schools. We've been actually, as a health department, with our wellness committee, partnering with the schools for several years to improve nutrition and to try to make that connection with farm to school. Several efforts with Cornell Cooperative Extension and BOCES and local school districts have been attempted, and we've submitted grants, farm to school grants that haven't gotten funded, but there's another round coming up. But this is a planning grant that will allow us to pull everybody together and hold a health summit so that we can actually come up with some very concrete action steps over the next couple of years. And we're going to involve all the partners that are interested in this issue. And we're focusing on school nutrition because it's a significant area where we think we can make a real difference. Because we have the local food hub grant, we're hoping to somehow tie into that, and focus on also, making the connection between farm to school, local farmers, and nutrition for kids with this health summit. We do have to set up a conference call with the grantor to hammer out some additional things that they would like us to do with this money. But the time frame for this is between now and the end of May, that we will be planning this and holding this health summit.
So at some time after May, the health summit would take place?
Probably
Before?
sometime between now and May.
Between now and May?
Well, not now, obviously, but over the next few months.
And that's coordinating the other organizations that are working on the same health priorities?
Right.
Okay,
Right.
so that's really good. Okay, are there any questions for Nancy? I asked Josh to do a press release on that grant award, because I think that that's really exciting. Okay, if there's no questions, thank you.
I have one other thing I'd like to share, along with the area of improving health. We have quite a bit of money left in our Rural Health Network grant for worksite wellness incentives, and we've been given permission to also reach out to Sullivan County departments and employees with this incentive. And I'll be reaching out to department heads to discuss what employee wellness initiatives they'd like to see. It could be something as simple as starting a walking program or providing a exercise equipment or gym membership, reduction in fees. There's just a whole list of possibilities. We have 4 other businesses in the community right now who have sent us proposals and are interested in worksite wellness, and we'll be implementing that over the next few months.
You mean to hook up with a business that would provide some of the programs?
Right. We have several small and large businesses that are interested in implementing worksite wellness programs. And basically, it's good for business to have healthy employees to reduce absenteeism and sick days. And it's research-based, and it's proven that it works. So we do have some incentives available to promote that with businesses and
Very good.
employers.
Okay, if there's no other questions, we'll move on to brief presentation on the division overview of costs mandated versus non-mandated. Josh and I had a discussion over the budget pie graph that came forward with the costs of the division as a whole. So I had just asked Josh to just kind of go over. Heather has copies of these, which we got last year, which they can update these numbers. The numbers that are on here, 2012 actual cost versus 2013 adopted, are a little bit different, but I'll let Josh explain. There are copies of these that Heather has, if anybody wants a copy of it, but I'll just pass it around to try to refresh your memory, and you'll probably remember the breakdown of it.
Yeah, Cindy and I had talked, and she had a question about the pie chart in the tentative budget. I think roughly if you look at the expenditures for the division, it represents about 50% of the total expenditures of the total county budget. But when you look at the county share figure, it drops to about 35% due to all the federal and state reimbursements they get. So Cindy had requested that we relook at, for all the departments in the division, every single program and whether they're mandated or not, the level of the mandate, source of the mandate, and then what those programs are costing us. So what Cindy had just passed around was what we had done last summer, and we're in the process of updating those with the 14 budget figures, and once 13 is closed out, we'll have the actual cost for 2013 to share with you. But I can I'll have Heather email this to the 9 of you so you can kind of look at this and refresh your memory from what we had done. But over the next couple of months, we'll have updates to this, and sure it'll drive some discussions that you want to have in committee.
Okay, so we'll have the actual numbers next month, and if you get a copy of it from Heather and then review it for next month's meeting, so that if you have any questions, we can try to address those. Okay. The next discussion is senior housing needs. I had conversation with several seniors in the county, and they had asked about the number of senior facilities and, if there's any issues at all. So I did receive the list of the total number of senior housing, which I'll pass that around as well. And then I had asked Karen and Debbie to just kind of maybe give us a little overview of what your feelings are with senior housing, if there's any needs that we can address.
Oh, it's one package?
Yeah, you can pass it.
Oh,
Yeah, that's the list. I think there's,
thank you, Josh.
there's numerous, it's one packet, should be stapled together. And I think the number of senior housing, if there's any indication if the number is adequate from what, working with your seniors, if there's been any concerns about it. I know we have some new facilities. There's one in Liberty, there's one in Worksboro. And if they're at capacity, or if there's a need for housing, who coordinates that housing?
There's always going to be a need for senior housing, always. the senior population in Sullivan County is increasing, expected to increase by 18% within the next 5 years. There are seniors now who cannot afford their taxes in their own homes and are looking to move into senior housing. There are waiting lists, and that's one of the issues. There's not enough housing. There are 14 complexes in the county. In the last 9 years, there have only been 4 complexes that have been new complexes built. Of the 14 complexes, there are 654 units total in those units.
650?
654 units, senior house apartments. We don't have a number for those other apartments that are handled by Section 8 with private landlords. I'm sure we could probably research that and get that information, but we don't have it right now. In 2005, our office and SLAC did a report of the housing needs, and it's still the same. We do need more housing. There's no senior housing in the western end of the county, none whatsoever.
Okay.
And I have had seniors from that area ask, and our office is separate from the senior housing complexes. We assist with the applications, we're in there providing services. But you have seniors in the western end of the county that would like to get into senior housing, and they don't necessarily want to move to Monticello or Liberty. They'd like to stay in their areas, which I understand. So we need to look at that and see how we can bring that about, but, Kathy?
One of the issues, I know, Jonathan and I were instrumental in getting the senior housing in Wardsboro, but Highland, Forestburg, and Lumberland do not have senior housing. And we've been talking about this for 13 years, but I remember when we got some state and federal grant money from Senator Bonasack for the facility in Wardsboro, one of the issues, and correct me if I'm wrong, is the township must have a pharmacist.
Right,
Okay,
right.
so that's one of the issues. But these smaller townships, there's not a pharmacist that wants to come there because the population they feel is not that great, so that's an issue. So you can try to get senior housing, but if you don't have the things that the developer wants, you're not gonna be able to get them in those
How
areas.
close does the pharmacy have to be, like?
5 miles.
5 miles.
5 miles.
5 miles, so the senior housing has to be located close to Main Streets then,
Right.
right?
The competitive nature of the grants and the tax credits that the developers need in order to make the housing projects viable also require there to be walking distance to shopping.
Right.
They're very competitive proposals statewide, and there's a limited amount of resources, so it gets very difficult in real rural areas to be competitive in the process because they don't wanna isolate several hundred seniors in a place where they can't walk to shop, or there's no transportation, there's no activities, there's no, so unfortunately, they tend to gravitate toward the Liberties, the Fallsburgs, the Monticellos, where there's an infrastructure. I know there's a project, that's seeking funding for another one in Monticello. But all those projects now fall under the regional council program, so they all have to apply the same as the others, and it's less money and more need like anything else, but it's, I know there's a couple others they're looking at, but they're all in and around Monticello.
So as far as, like, I know on that list that, I passed around, there were adult care centers. How are they different? Cause I know Jeff has one, they don't
Not
take the
regulated.
seniors, they're
They're not regulated, it's an adult home. It's not apartment style living. They're supervised, there has to be something between, senior housing and nursing home. There's gotta be something,
it's
like an assisted living facility. There are seniors who don't qualify for senior housing because it's income-based. So they're looking for something, but there's nothing here for them. An assisted living facility would probably provide that living, still living independently for them, but we don't have that. I did speak to Tommy Ting last fall, and he had proposed or is proposing an assisted living facility here in Monticello, but I have not talked with him since that time. And and Sullivan County does not have any living assisted facilities. The closest ones are Orange County. So there has to be senior housing, there definitely has to be senior housing for our seniors who no longer want to live in their homes, but they still want to live independently.
So do you have a sense of the 654 units with waiting lists?
Some of the waiting lists are 6 months to a year. The only complex that does not have a waiting list is Golden Park and Liberty. And I spoke with them yesterday, but the others are 6 months to a year. Section 8 has closed their list because their list is 2 years long right now. The waiting list is 2 years long. And of course, you know, the only way that you get into senior housing is if someone goes into a nursing home, moves out of the area, or they pass away. We do have several seniors, for instance, at John Crawford, who have been there since John Crawford was built, and they're in their 90s now. But now you see a different influx of younger seniors moving in. They also have to, or required to, set aside some apartments for disabled people. So you get a younger population there also. So that becomes a problem because, and we get those calls, they have parties. There are other things going on in those apartment complexes that we don't know about unless the senior calls us because they're afraid.
So they're required to accept someone in a younger senior over a senior that's been on a waiting list for?
No. They have to accept the senior, but they also have to set aside X number of apartments for disabled individuals. If they're on the waiting list, the senior gets preference, but there's still a possibility of that under 60, well, you have to be 62, under 62 person moving in.
I see.
If they're just, if they have a disability.
If there's no waiting list,
There's no waiting
if
list.
there was a waiting list, then the senior would
Gets
get-
preference.
Okay, thank you. I learned something. Any questions for Debbie? Okay, thank you. Okay, we'll move on with the resolutions. Number 1, to formalize a parole review committee for the review and recommendation of the discharge of parolees into Sullivan County. Motion to discuss? Second?
Second.
I'll second. Okay, the resolution, came out of a meeting that was, set up on October 29, 2013 with the Department of Corrections. The representation from parole at the meeting had, when we addressed with law enforcement, probation was present, representative from the DA, the Commissioner of Health and Family, and addressing, we got 90 parolees in 2011, and as of October, when the meeting took place, we had 67 in the month of October. In the meeting discussion, the Commissioner of Parole had said that there are committees that set up review committees to work with the Commissioner of Parole to increase communication and with the goal of trying to address the number of parolees coming in, being that Sullivan County has difficulty providing resources as far as housing, jobs, transportation. The goal of the parole department of New York State is successful reentry. And being that law enforcement was present in the meeting and spoke about how there's a high percentage of parolees that do reoffend, I think it was 85% reoffense, that the conversation coming up with solutions to try to address the number of parolees and try to reduce them through the Department of Parole. It was recommended to set up a review committee. So if you read the resolution, it says, whereas during the course of each year, a number of parolees are released into Sullivan County, New York State Department of Corrections makes the determination as to where to release the parolee with the goal being successful reentry into society. The responsibility for housing, job training, assistance with medical, transportation falls on the Division of Health and Family. Whereas a number of these parolees reoffend, increasing our jail population, and Sullivan County is challenged already with high unemployment, poor health ratings, inadequate housing, rising crime, and desires to be more carefully review each parolee to determine the availability of adequate resources and the actual county of residence prior to incarceration. The Department of Corrections has expressed a willingness to work with the county and the Commissioner of Health and Family in a cooperative effort to determine an alternative release location with the goal of reducing the number of parolees requiring the provision of temporary housing and other services. So to accomplish the goal, the Sullivan County Legislature has determined that it would be in the best interest of Sullivan County to formalize a parole review committee to include the Commissioner of Health and Family, as well as representation from the county legislature, New York State Department of Corrections, 9 to 11 members representing Health and Family Services, local law enforcement, the DA's office, Department of Probation, all who would serve at the pleasure of the legislature, and the parole review committee will meet monthly for the purpose of doing the above. So are there any questions about the resolution, Kitty?
I just wanna speak in favor of this, especially regarding number 6 and number 7 in the whereas. As I remember back in October, I believe, is when these people arrived, and we pinpointed the fact that this area seems to be getting an awful lot of, people released and arriving here to our borders on Friday afternoon, and that created a problem. So knowing that they're going to work with us, as they stated, in advance, so that we would have a better idea, so that we could have a better setup for housing, I think that is expressed in the number 6 whereas, and the number 7 whereas incorporates all the people that are dealing with the issues that surround us when somebody gets released from prison. Could have been in prison coming out of Brooklyn, coming out of Buffalo. Doesn't matter, for some reason they might have somebody here, or they passed through, or committed a crime here, and therefore they get released here. Doesn't make sense. So incorporating these various bodies to a 9 to 11 member group to try to come up with a more viable solution, maybe working with workforce development, since we're looking at one of the major things is to make sure that they successfully reentry. I think those two whereases will help keep our crime rates down, our number of parolees that are being released here just because it might be easier for the state to release them here than elsewhere. And I think that those are important pieces so that our jails don't get overbooked, that we're shipping out, because the first place until they go to trial is into the county jail. So they're getting released from a state prison or a federal prison, arriving into our communities, potentially not having the services that they need in order to successful reentry into society. So I think this is a very good committee and resolution to go forward, and I really support this resolution.
I just wanna say, I don't care, first of all, I wanna, so the committee's gonna meet every month and hash out all those issues that Kitty just addressed, but do the people on this committee have that kind of time, is my first question. My second question is, you can put any resolution you want together, but when somebody's released from prison or jail, wherever they're going, we have to follow the state guidelines. You have to, unfortunately or fortunately, the county has to provide them with shelter, period. But, I mean, it just seems like, Kitty, when you talk about state prison and jails, I think you're mixing apples with oranges, but
That's
do
the
the
reason
people,
for the
do
number
the people
6
have
whereas,
the
Daphne.
time on this to sit at another committee and rehash things that are already law? I don't know.
It's the
Well,
number
as-
6 whereas, if you look at the number 6 whereas,
I
the
can read, I
County
see
and
it.
Health Commissioner, the Department of Corrections, Community Supervision, those people said that they'd work with us.
Okay.
So if we don't meet, we're not gonna be working with them, and we'll end up with those problems. increasing instead of decreasing. We might actually come up with a solution because of the number 6 in the whereases.
Well,
So
this
I
was
see
a
this
People
as
should
a.
be doing their jobs already, I don't think that.
No, this was a consensus in the committee. Law enforcement was expressing concerns that because we didn't have adequate resources to put some of these people in the motels with no jail, no kitchens, no transportation, was actually not working. And I know that there were issues discussed, and the department was present at the meeting. And I had a subsequent conversation with one of the representatives, and they were more than willing to meet with us, and they were supportive of the idea of reviewing, because if you figure we get 80, 90 parolees a year, you're looking at maybe 6, 8, 10 that come in a month. It wouldn't have to be all these groups meeting every month. It would vary depending on what the Department of Corrections, they communicate with the commissioner of the division, and whether they're gonna send no one that month, or whether they're gonna send 6 people that month. Jonathan?
When you say without how's the mechanics gonna work? They're gonna meet, but they're not gonna vote? How are they gonna communicate let's say they review 11 applicants. They're gonna allow you to review the 11 people they're sending you.
What happens now is we get notification from Department of Corrections, and I think they're required 10 days in advance to notify us of a parolee being discharged into the community. And I mean, right now, all of those individuals, most of those referenced in the resolution, are working on some component of this individual's release. So what I would envision from this is, 1 hour a month, we'll have 5 or 6 proposed releases, and we'll have to figure out when to time the meeting in the month. And we review the first thing we want to look for, because what we're seeing is, were they truly a resident in the county prior to incarceration?
But
And-
you're doing that now, right, Randy?
Right, we have started to do that. We are, pushing back a little bit where we can, but more so getting the parole department's representative to work with us at maybe they were a resident in a motel prior to incarceration, but maybe there's family in the Bronx, and being in the Bronx would be better because they have more natural supports there. So getting the folks together at the table, going through 4 or 5 per month should not take a long time. And then, you may be in a situation, because some of these individuals are very, high risk, volatile, just kind of monitoring and continuing to communicate will be critical.
So then this committee would come up with
Probably.
decide and say, okay,
increase
of these 3, we don't feel they should come back to Sullivan County for the following
that's
reasons.
gonna be a dialogue
And there's gonna be no voting members, are they just gonna, is it ultimately fall on your shoulders? Is this, the group's gonna say, Randy, take these 3 and go call corrections and tell them we don't want them for these reasons?
The
or-
regulations,
We're gonna
it's really a joint decision, between the department and parole. But it's not about being able to necessarily veto it, but more so coordinating the services that are needed. And I'll use an example that Joe Todora had pulled a meeting together last week on Friday regarding an individual who's going to be released into the community, and this individual's been incarcerated a very long period of time and is potentially very dangerous. So getting the individuals around the table and coordinating the plan, is more about enhancing the service. And that
So
can be
the ultimate goal is not to reduce the number of people that come here, it's gonna be to better serve them when they get here?
No, I think it's to make sure the ones that do come here, were truly residents, and then the ones that are here are quickly put into the, searching for a job, and then, not in motels, and where possible with families, and so that they can be more productive no citizens reference.
Well, in the meeting, the discussion was, successful reentry, Sullivan County, lacking, improved housing for them and jobs. And to try and, address the fact that if they were truly from another area, statistics show that connections with some kind of family connection, the rate of reoffense is improved. So with the communication with the Department of Corrections, they were more than willing to increase communication and work with us and address some of these issues. So I really think it's a win-win.
If that's your goal, is to make sure that we're only getting those that should be here because of the reasons you outlined. That's certainly has merit to it. But I think if that's the goal, I think you would want a much smaller, more nimble committee made up of the few people that could have biggest input and impact quickly in that decision. That's one, if the goal is to, we know we're getting these people, and we have to be better prepared for them so they can have a much more successful chance of sort of success, I think that it's a different group of people, different committee. And I think both have merit. I just think we're trying to maybe trying to mix too many things in the bowl here. If it's about successful, I think your idea is great. Everybody should be at the table. You should have a plan for the minute they step on the ground here. Otherwise, we're not going to be successful. But if we're trying to limit the number that come here, maybe that should be a much smaller group that can meet as you get the application, do an investigation, and get a response back, and
Well,
have a direct one.
It's not, I don't see it as so, cut and dry. I see it as a discussion that is growing out of law enforcement concerns and needs, as well as, probation. I mean, they had concerns. There's a pre-sentencing report that they didn't feel was reviewed adequately, so they were making the recommendation that we would pre-review that. There would be that group that would be able to communicate with the Department of Corrections. And that was basically the goal that came out of that committee, to increase communication with the Department of Corrections so that they can hear law enforcement needs, probation needs, health and family services resources. So it's not gonna be one solution that we're gonna come up with. I think the committee is a win-win, really, because out of the committee discussions, I think we're gonna hopefully be able to improve resources as well. Scott?
There's no financial support to this, is there? This is, there's
It's
no,
hours
we're
of people's
not using any
time.
resources.
It's
Since,
fair.
in my opinion, if there is no committee that exists on this level at this point, doing it now, if you have the cooperation of the Department of Corrections or the Commissioner, give it a try. Try it, see how it works. If it turns out that it needs to be more focused on one side or the other, then you try to do that. If it's a failure, you move on. But as long as there's no resources that we have to put, and it's only a couple of meetings, I don't see any downside to it.
And if I'm correct on this, not all of these meetings have to be everybody face to face in a room. It could be some people on a teleconference call.
Well, that's,
So, I mean,
Scott
it
says there's no
can
resources.
happen.
When you talk about probation and the district attorney's office and Randy, you're talking about everybody's paid here, folks, so it may not be resources that we're adding to a resolution, but it's taxpayers' dollars.
Well, I
And
think
I agree
it's-
with Kitty, if it's maybe a phone, but to meet every week or every month
But
to
some
try
of
to.
it can
We'll
happen.
tweak that, though,
So it
like
is fine.
Scott
It
said.
says,
Phone.
doesn't this say it's a monthly meeting?
Yeah.
Right, but like,
For an hour, I mean.
These
I
meetings
say
are
if
supposed to be
we-
an hour
if
too,
we-
so
if we
don't say
have
an
some-
hour.
But I see if we have some, right, I know. I see if we have some, I think if you have some success with it, then you're winning. But if there's nothing over the course of 3, 4, 5, 6 months, then I don't think anybody's gonna continue to come to the table, so it'll be a moot point.
I think it's a good idea. We could give it 6 months.
Fine.
Randy will be in communication with the legislature, and I'll give reports on a monthly basis, and we'll see where it goes.
So, maybe we need to call the question.
All in favor?
I'm gonna abstain.
Any
from the board
opposed?
meeting
Okay,
for further research, thank you.
okay, thank you. Okay, thank you. Okay, we'll go down to Department of
There's no
Community
county attorney
Services
here.
resolution.
It's going down.
What's that?
Nothing.
That one passed,
Where are
right? Me, Jonathan, and Kitty. Okay. To authorize a contract with Taconic Health Information Network and Community.
Move it.
Inc.
Moved by Kathleen.
Second? I'll second. I think it's a, is that the pass-through, Joe?
This is,
Yeah.
this is an agreement that, for the county to sign with Think, which is actually the Regional Information Center for the Health Department. It basically is a data sharing agreement where we agree to share data, keep it confidential, comply with HIPAA, CFR 42, all those things that we have to, I have an alphabet soup that I can go through. But what it also does is, I've been participating with the Think organization for the last 5 years in a HEAL grant. This will allow us to receive money that we're using to purchase laptops for our caseworkers to have in the field and some other information technology. Basically, it's gonna allow us to access the $41,000 that's associated with this grant. But it also allows us to, we've agreed to share data, so electronic.
This was what you had discussed
told you it was
last month,
coming.
right?
Yep.
Mhm. So there's no county share and
No
it's.
county share.
Yeah, okay.
There's no county share, but, again, the exposure to the county is that we'll be sharing people's electronic medical records electronically. So, for example, one of the partners in this grant is the Hudson River Healthcare Program here in Monticello. If we share a client, Sue Smith, who is my prime example for anybody who has any problem, Sue Smith. She goes to the health center there, she's being treated for diabetes, high blood pressure, whatever, and she's coming to see us because she's,
Depressed about it.
depressed. We would be able to look and see what Sue's being prescribed there, and we'll be able to take a look at, on our records and say, okay, here's what she's being prescribed.
So it's
This is a better way.
coordinating care
It's a
for
better
her as well?
coordination of
Okay.
care. It's actually a requirement under the Affordable Care Act also, that we're gonna have to do this stuff.
Are there any questions for Jeff? All in favor? Any opposed?
Who is it?
And be prepared for Nancy to come back to you next month with an agreement to join Think also.
Health Department will also be requesting to participate, and ours will be primarily for communicable disease surveillance.
And this is born out of the electronic age, right?
Yep,
Yeah,
pretty
okay.
much.
Okay, Department of Family Services resolution to authorize the county manager to enter into agreement for the provision of U.S. Department of Agriculture's food nutrition services.
Move it.
Kathy, second. Jonathan.
Nancy, is that yours?
No,
it's,
it's
Oh,
Randy's.
Yes,
Randy, yeah.
it's a pass-through of federal funds to the state and then to the county, and we in turn, turn those over to Cornell.
Nancy has no
Just not-
reservations this month.
Okay. Any questions for Randy? All in favor?
4-0.
No opposed. Okay, and the last resolution to authorize county manager to enter into agreement for funding and for the provision of child care related services.
Move it.
Kathleen,
Second.
Jonathan.
And that's a pass-through as well?
Yes, it's, through OCFS, through, the agency, and then to the Child Care Council for child care provider registration and inspection.
Okay, any questions? All in favor?
4-0.
Okay, did anybody else have any other report from departments? No?
I did. I just wanted to share that, and close the loop with that, preschool Medicaid billing issue we had last year, that we did receive a check in December for $246,309. That was through the efforts of our staff and, the temporary, account clerk that we were allowed to hire.
So this was the Medicaid reimbursement back to the county?
Right.
Okay, that's excellent. Okay, thank you for that, Nancy. Public comment? Sandy?
I'd just like to comment on this parole review committee. I think you guys have set up a ton of committees and task force for the prescription drugs. We have the grants that they're applying for. for the, public health concerns such as the childhood obesity. We're starting to realize that, putting Band-Aids on stuff don't work, and you have to fix the underlying problem in order to create change. And I think that this is very effective. I think that in the Public Safety Committee meetings, we've heard time and time again, the rates of recidivism, and the amount of crimes that even if they're not a violent crime against a person, if your house is burglarized, that's still a crime against a resident of this county. And if one person who isn't supposed to be here isn't here collecting services or possibly burglarizing a home, that's a significant impact, only on the one person that he may have done that to. He or she, I should be correct in that. So I think this is huge. I think it's a very proactive step, and I'm very glad to see that they came forth.
Thank you, Sandy. Any other public comment? Motion to adjourn?
Kitty?
Thank you, everyone.